I'm Dr. Anthony Maloof from Eyes and Faces and Corneal Oculoplastic Surgery, and welcome to this video on a patient called Miss G, the psychology of Graves' disease. So meet Miss G. You'll see from this photo she's got double vision. So this lady developed double vision a few years ago. She didn't know what was going on. She was told she had Graves' disease. So she was seen by a doctor and given lots of steroids that made her feel terrible. Double vision didn't go away. She was then told that she had to have her thyroid removed, so she had it done, and was disappointed that her double vision didn't go away. She then started to ask questions, and one of the doctors even asked her why her antibody levels was high, and she was berated by her specialist. This didn't please her very much. She became very, very, very despondent. Well, she felt psychologically destroyed. She stated that. She lost confidence. She felt there was no hope. She felt there was that no one would listen to her. And what's more, she felt so frightened after being berated by a specialist. She felt frightened to even get another opinion. She withdrew. She basically withdrew. She gave up on the biomedical model of treatment. She said no one cares, no one can do anything. She gave up driving because of her double vision. She gave up interacting with family and friends, refused to have a photo taken, and to cope, she simply placed a covering over one eye to eliminate her double vision. She thought that this was her lot in life. So what this shows is that Graves' disease is not just a disease that affects the body. It's what I call a bio-psycho-social spiritual disease. And I tell my patients, I'm operating on your mind first. Once they understand that, if we can offer an intervention to improve how they feel about their disease, the body follows. That's the easy bit, fixing it surgically. It's making sure we can rescue their mind. Well, for this lady, the first step for her is to switch off the disease process. There's no point in treating her when she's already still active. We need to switch it off. There's all sorts of new medications being pushed around and with all sorts of promises, but a treatment I've been using for 20 years and one which has proved exceptionally effective with almost zero risk, you can never say no risk, is low-dose orbital radiotherapy. So she will have low-dose orbital radiotherapy. And what that will do is it will switch off the disease process. Think of it this way. It's like building a reinforced concrete wall around the eye sockets so the eye disease stops. So I tell my patients that let's stop the disease first, and once it stops, then we will restore. And then she'll get her confidence back. So the first step is to stop the disease process, which we'll do with radiotherapy. And then the next step will be to correct any structural problems, such as double vision or bulgy eyes. In her case, she'll probably just need her double vision corrected. The process takes time, 12 to 18 months all up for severe cases. I'm hopeful this lady will get there within that time period, hopefully within 12 months, in which case they're literally reborn. They're new people. So this lady was really despondent. There's no hope. There is always hope. Get in, get early, and we'll get it fixed. Thanks again for watching. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.